How do doctors interpret cystogram analysis results? Imagine having an internal map of your bladder that helps doctors see what's happening inside. That's what a cystogram provides. It's a special imaging test that uses X-rays and a contrast dye to visualize your bladder's structure and function. When doctors review the results, they look carefully at the images to find clues about your bladder health. First, they examine the shape and size of the bladder. A normal bladder is oval or round and fills and empties smoothly. If the bladder looks irregular, enlarged, or has unusual pouches called diverticula, it might indicate underlying issues like bladder weakness or other conditions. Next, they check the wall of the bladder for integrity. Any tears, perforations, or thickening could suggest trauma or disease affecting the bladder wall. The radiologist then observes how the contrast dye fills and empties from the bladder. If the dye doesn't fill evenly, or if it leaks out unexpectedly, it could point to blockages, strictures, or nerve problems that affect how the bladder stores and releases urine. In some cystogram types, like a voiding cystourethrogram, they also look for vesicoureteral reflux. This is when urine flows backward from the bladder into the tubes connecting the kidneys, which can lead to kidney infections or damage if left untreated. Another key part of interpretation involves searching for any suspicious masses or growths inside the bladder. These could be signs of tumors or other abnormal tissue. If such findings are present, your doctor might recommend additional tests like cystoscopy or biopsy to get a closer look. After the bladder is emptied, the radiologist may measure how much urine remains. A high residual amount can mean the bladder isn't emptying properly, which might be caused by blockages or nerve issues. Once the radiologist completes their review, they prepare a detailed report summarizing their findings. This report is sent to your healthcare provider, who will discuss what it means for your health. Based on these results, your doctor might suggest further testing, start treatment, or monitor your bladder over time. In cases of bladder cancer or other problems, cystogram results are vital for detecting structural issues early. They help determine if you need procedures like cystoscopy or biopsy to confirm a diagnosis. Always remember, interpreting these images is complex, and results should be discussed thoroughly with your healthcare team to understand what's best for your individual situation.